Welcome to Voices on Aging, brought to you by Juniper Communities. My name is Janice Whitaker, and I serve as the Administrator and Community Liaison for the Center of Geriatric Nursing Excellence at the Penn State College of Nursing. It's my pleasure to serve as today's host for a conversation on connected care and how it's being delivered in senior living communities. I am joined by our guest, Dr. Eric Gomer, an expert on adult and geriatric medicine with a specialty in chronic care management, along with Ann Campbell, Regional Director of Operations for Juniper Communities, and Sherry Hetrick, a family member of a resident at Juniper Village at Brookline Wellspring Memory Care. The world is more connected than ever in so many ways. The focus of our discussion today is on connected healthcare. Dr. Gomer, would you please help us understand the concept of connected care and why this approach is important in senior living communities?
Sure. Connected care is very much what it sounds like. This is a comprehensive, coordinated care for our residents that connects providers more easily with associates, with other providers, anyone who's involved with their care. Why this is important is, a lot of doctors, providers, they operate sort of by themselves in a silo, and they're not able to get the information or data from specialists, for example, or from people who are working with our patients and residents. So this model actually helps avoid duplicates, something as easy as ordering a lab that a specialist or someone else may have already ordered, or getting up-to-date information like a change in a patient's medication that would be very important. So this helps kind of seal that gap that is the communication breakdown, is connected care.
Yeah, so you've mentioned a couple of the advantages of connected care. Could you elaborate on that, as well as how it's being delivered in care communities?
Yeah, we're actually trying to break down, working in a vacuum. And so what we do is we enhance communication between providers. There's also technology that helps provide up-to-date data and information to providers. What we look for are gaps in care, and that can be done through this model, utilizing different technologies. And so any gaps in wellness, in preventative care can be identified a little easier. And obviously, treatment can be started or discussed.
Yeah, so I see there's many benefits to connected care, and it has been shown to improve quality and continuity of care, as well as monitoring our older population.
Yeah, that's right. That's how we're able to transform this care. We want to enhance this connectivity among healthcare providers and access to technology that will further help this. In a nutshell, this really is important to avoid duplicate care, to avoid medication errors. And, I have many patients where I do find these gaps, and it is a struggle to make sure I'm coordinating with their other specialists, with other associates or staff that are working with the residents.
Well, Juniper Communities has been a pivotal leader in providing connected care for its senior housing communities. Ann, could you please tell us about Juniper's connected care program?
Sure. Thanks, Janice. Juniper's signature Connect4Life program has been a pioneering model of connected care for senior housing. It works by integrating care and service delivered on site by our Juniper associates with that offered by the ancillary clinical providers like Dr. Gomer. And this creates an integrated team. The three components of Connect4Life include integrating primary care physicians directly into senior living settings, the use of data and outcomes to drive quality, define performance, and guide operations, and cultivating well-being through therapy-driven physical wellness programming and seamless access to other services and strategic partnerships with our providers.
So what are some of the services included in the Connect4Life program at Juniper?
Juniper offers on-site services like primary care, like I just mentioned, therapy, which would include physical, speech, and occupational therapy, can be specialist care, diagnostic services, and other services such as home health and hospice. The program provides individualized care service that is both high-tech and high-touch, using an electronic health record with data from multiple providers, and high-touch providing these services through a medical concierge that can help improve the resident experience.
Yeah. So as you described the Connect4Life program, you mentioned data and outcomes. Could you share some of the research results on this program?
Sure. Our Connect4Life program has been proven to improve residents' care by decreasing hospitalizations and rehospitalizations. We had an outside third-party research company look at our data, and they were able to show that our research was able to show that Juniper had 50% lower inpatient hospitalization rates and more than 80% lower rehospitalization rates compared to non-Juniper Medicare residents with similar conditions.
And Dr. Gomer, could you comment on some of the relative research and medical studies?
Sure. Like Anne was talking about, medical studies also reveal that this integrated model, it just yields higher quality care, better outcomes, and importantly, as was mentioned, fewer hospital admissions and readmissions. And it makes sense anytime you enhance communication between the healthcare team, all the people that are part of the caring model for these residents, it's going to reduce these things. And, you know, one thing that is important is cost saving. So up to 15 billion or more dollars could be saved in hospital inpatient spending when we utilize this model.
And so it sounds like there is certainly a business incentive for this model, as well as the human incentive as well. Anne, any further comment?
Sure. Statistics show that a senior living community providing these kinds of on-site services makes the resident truly benefit by having on-site primary care, this high-touch foundation of shared data, and the high-touch coordinator. A resident is delivered a much better experience and a higher quality of life.
Sherry, as a family member of a loved one living in a care community, can you share with us your experiences with the Connect4Life program?
Sure. I can vouch for what Anne has just described. Connect4Life brings new meaning to under one roof. Not only are the services provided in one location, but Juniper is my mom's home. Her friends are there. Her life is here. And all the details are coordinated under one roof as well, within a single electronic health record. It's clear and coordinated, not complicated or confusing for residents and family members overseeing care arrangements.
Today, many individuals who live in our communities have health challenges and medical needs that we need to address, while giving them the opportunity to enjoy each day without the worries associated with managing healthcare appointments, prescriptions, and so forth. Our Connect4Life is personalized and centered around the person, their needs, and their goals.
And we, as well as mom, appreciate the convenience of having the services available right here. We no longer need to worry about making appointments, driving mom to appointments, and waiting days for a callback. Her care is coordinated and delivered at Juniper, and we appreciate that.
Our overarching goal is to minimize the risk for rehospitalization and maximize the overall well-being of the individuals under our care. We believe that providing housing with supportive services and integrated clinical care, we can affect utilization and impact costs. But more importantly, we impact overall resident well-being. Connect4Life is a model that works for the community, the residents, the providers, and society.
So Anne, it sounds like the implementation of a strong electronic health record would be important to facilitate this type of program. Can you tell us about how technology is integrated into the Connect4Life program?
Sure. By having each one of the major players, providers, the folks at the community, different specialists, but having all of them work from the same playbook, the same electronic health record, and having access to real-time information that is accurate and the same, they're able to make decisions. They're able to work as a more coordinated team by having access to that information. So it really just puts everybody in the using the same playbook.
Yeah. And Dr. Gomer, would you like to comment on that from the medical perspective?
Well, she summed it up nicely. What I like to think about is how it can affect me in the point of care right there in the room with the patient. And, prior to, you'd have to get on a phone and be put on hold to try and talk with a specialist or get their medical records, or have your assistant look up labs or things from physical therapy or whatnot. And having an electronic health record where it is right there, accessible with a couple of clicks, while you're with the patient, you'd be able to update them and your knowledge and affect your treatment plan right away. So it helps streamline the process for sure, which is a benefit for the patient and me, of course.
So it's not only a matter of sharing accurate information in a timely way, but really improving efficiency related to care as well. So.
Yeah.
As a family member, I can chime in that I have 100% confidence when somebody from memory care unit calls me with just an update on appointments mom has had, or I call in to get an update that they have everything in front of them that they can report back to me. So that's a very good feeling as a family member that I'm getting a complete picture. I have confidence that my mom's well taken care of, and everybody's on the same page. So as a family member, it's a really important piece as well.
Yeah, thank you for adding that piece. So not only is it improving the coordination and quality of care, but the communication as well to not only the resident, but their family members. So I'd like to thank our guests today, Dr. Eric Gomer, Ann Campbell, and Cheryl Hetrick, as well as our listeners for this engaging and important topic on connected healthcare. Thanks so much.
Thank you.